And we are back on this 0 hour. Joining us now is a good friend of the program, a good friend of ours. Nancy Altman is co-director of Social Security Works. She has a long and distinguished career in the field of social insurance. She understands this stuff, and we're here not to talk directly about Social Security, but about a different idea. Nancy, thanks, as always, for joining us.
Thank you so much for having me.
Always a pleasure. And now I have to say I was caught right away by the title of your latest piece, which you co-authored with Merton Bernstein. Mert Bernstein is known to many of us as a leader in this field as well, a former professor of law and a founding member, I believe, a board member of the National Academy for Social Insurance. So you and Mert Bernstein wrote a piece titled Medikids, a proposal to improve children's health care, reduce public program non-benefit costs, and shrink adult healthcare outlays. Other than what the title gives away about your proposal, tell us a little bit about that, if you would.
Well, Medicare was intended to be just a first step. In fact, at the time Medicare was enacted, there was a debate about whether there should be this kind of universal program for children or for seniors. What should be the first step? Because, as you know, seniors have the real dire need, but children, if you give children good health, it lasts a lifetime. So this is really a continuation of the idea that really was behind Medicare, and that is that all of us together healthcare should be a right, and that we can't, overnight change our system, but there is widespread agreement that children should have health insurance, even if maybe their parents are irresponsible or whatever whatever the opponents want to say. People understand that children are innocent and they need health care too. And it actually is quite efficient to provide them with health care. The problem is we have a crazy system now, this patch quilt system, where there are all kinds of, for public health insurance, there are all kinds of requirements about income and assets, and so a lot of money gets wasted. And what Mert and I are proposing is a system that will be very efficient, that will spend the money, just as Medicare does, on providing health care, not on CEO salaries for insurance companies, not for advertising costs, and certainly not for asking people to do a lot of paperwork to make sure their income is below the eligibility limits.
Right, confirming eligibility and so on. Now, a couple thoughts before we get to the specifics of your proposal. I think the principle behind it, or the principles behind it, are in a way the most interesting of all, and the details flow from that. And first of all, I'm fascinated to be reminded that there was some debate about whether to begin Medicare with the elderly or with children. You gave a good explanation of why, and I would add to that people at either end of the life experience, children and the elderly, and older Americans, I guess the closer we get to that the eligibility age, the less we want to use the word elderly, but that people at both ends of the spectrum have special needs, for example, or it's probabilistically speaking, and are part of the fabric of life, but may not be the fully contributing economic actors they are, let's say, in their prime working years. So I can see, so a fabric of life approach would say, let's treat them both in a somewhat similar way. Now, in this country, it is now assumed in the 50 years or so since Medicare that when you're older, you will have health care. And as you said, we don't worry about eligibility benefits. We don't expend a fortune trying to exclude billionaires or whatever because there's so few of them. Is that the kind of logic we should be looking at with children too? That why should they be treated any differently than the elderly?
Well, and in fact, it's an interesting point that in the Social Security debate and that there's some argument which the other side uses that somehow we're being unfair to children. We're expending too many resources on seniors, not enough on children. This is a way of equalizing that. It's health care for all of them. It'll still be more costly for Medicare because seniors, of course, have greater health and more expensive health care needs than most children have. But yet it's the concept that, as you say, at both ends of the life cycle, we want a healthy society. With children especially, we're talking about them being more productive adults, healthier adults. So it really is an investment in all of our futures. So it's something that makes sense. We equated in the article to public education. In the 19th century, there was a debate about whether people should pay for their own education. The concept there, though, again, just like healthcare, is that we are all better off if children are well educated. We are all better off if children are healthy. And that's the concept behind it. And it is, as a country as wealthy as ours, there is no reason we cannot provide this kind of care.
Well, it's a compelling point. And by the way, I don't know if you and we're talking with Nancy Altman, co-director of Social Security Works. I don't know if your co-author, Merton Bernstein, and you came up with that term, Medikids, but it's also a catchy title. I like it. Where did it come from?
Well, I don't know. Mert might say that he claims credit. I thought I came up with it. So between the two of us, we came up with it.
Right. You guys are worse than Lennon and McCartney, I can tell. But listen, I guess then let's talk a little bit about the specifics of your idea, because when I first saw the title, I thought, oh, well, this is simple. We're going to provide universal health care coverage to everybody under 18 using the Medicare infrastructure. But I don't think it's quite that simple. I think you've got something a little bit different in mind, right?
Well, it's not quite that different. And I should say one more thing about the title. As I was saying that, it may be that Bob Ball and Wilbur Cohen once mentioned that, who were involved in the enactment of Medicare. They may have had that title, because I know I've talked to them while they were alive many times about the history of the program and this point about covering children. So someone came up with it, but thank you for liking it, and because I think it's catchy as well. But on the more serious point, obviously children have somewhat different health needs than seniors. We're now seeing the whole issue arising with vaccinations and so forth. And I think most of the anti-vaccination people are not doing it because of cost, but this would remove a cost barrier for something that's important for public health. So they're not exactly, obviously, the same needs as Medicare and as seniors need, but the basic structure of a federal program that is not means tested, where you get all the savings from what we now have, Medicaid and S-CHIP and women, infant, children, all of these various programs with different kinds of criteria and lots of administrative overhead would disappear, and we would have a federal program. We're open to how it could be financed, but it would not be expensive to do, because, as they say, the vast preponderance of children are quite healthy, fortunately. So it would not be an expensive program. It could be done through wages. It could be done other ways. But the idea is that the federal government, for all the people who say government doesn't work, Social Security, Medicare are programs that work very well. The per capita and cost of Medicare, administrative cost, is lower, even though they're the most expensive. People who are old or disabled have the highest medical bills. Their administrative costs under Medicare are lower than you find in the private sector. And the same kinds of efficiencies could be applied to a Medikids program.
You know, when you start to think about the idea of a Medikids program, it seems to make so much sense. I mean, as you say, the cost would be far lower because we're dealing with people in their healthier, earlier years or of life. The payback would be much greater. Of course, we didn't create Medicare for its cost effectiveness, but because it was the right thing to do. And yet, a Medicaid program would save in future medical costs. It would create healthier, more productive citizens, as you pointed out, which would have a social and economic benefit. So, and it would be, as you say, much cheaper. So why isn't this, as our mutual friend Alex would say, a thing? Why isn't this a thing? Why are people pushing this?
And actually, one other point in its favor is that poll after poll shows that the American people favor health care for children. As I say, they may have doubts about whether adults, and there could be disagreement about that. But I think there's quite overwhelming support for the idea that children should be educated, should have health care, should be taken care of. So I think it would be very popular too. I dare say that it's a lack of imagination on the part of our policy leaders that as they say, Medicare was intended to be just a first step, and it's been highly successful and very popular. But the centrist of the mainstream of our political world, unfortunately, seems to be very focused on the private sector. Capitalism is great. We've got it's created a lot of wealth, but on certain kinds of things like this broad-based insurance, we want it nonprofit. We want it. I think it should be the government, where you are not. There's no profit motive there. You're simply trying to present a good for all of us collectively. We all pay in and we all benefit.
Well, and that gets to the final point I wanted to make. Nancy Altman, you are co-director of Social Security Works. You and Eric Kingston have written a book by that name, Social Security Works, which is just out, available at your local bookseller. We recommend it. And one of the points of that book is exactly that Social Security works. It is extremely cost effective. One of the reasons it's extremely cost effective is that virtually everybody is in it. You don't have these cumbersome eligibility tests and tracking requirements and all that stuff. So it is a great mechanism in the case of Social Security for expanding retirement and disability benefits. In a sense, this is one of, as you say, capitalism and the private sector have their place, but this is one of the places where government can excel. And in a sense, I got the feeling from the Medikids proposal, besides its basic value, and that it also was a way of kind of saying Medicare works, like Social Security works. Let's expand that. In the 60 seconds or so we have left, any thoughts on that?
Exactly. I favor lowering the Medicare age. After all, you can retire at 62. You should, and claim benefits. You should be able to claim Medicare at 62. Medikids is based on the same efficiencies, the same model. So you are exactly right. We should be Social Security works, Medicare works, Medikids would work. We should be expanding them all.
And I would say 55, not 62, personally, for as a transition to making Medicare an option available to all. But whether it is 55 or 62, I think that makes the numbers show that it would be economically cost effective. And I think maybe if more Americans saw how well it was working for their children, they might want it for themselves as well.
I think you're exactly right.
Well, we're going to have to leave it there, but Nancy Altman, as always, thanks for a great conversation and thanks for a great idea. The Medikids proposal, which you can find in the Huffington Post, co-written with Merton Bernstein, and of course, look for the book Social Security Works, written with Eric Kingston. Thanks so much for joining us, Nancy Altman.
Richard, always a wonderful pleasure. Thank you.
Absolutely. So there you have it, folks. Medikids, is that the campaign of the future? Let's see, because we need to do something about the health of America's children and the future of our health system. So we will keep you posted on that. In the meantime, it's time for a break. We will be right back after this. I am Richard, RJ Eskow, and this is The Zero Hour.